If someone told me that the public could access his or her personal health information online, I would be conflicted. On one hand, I could easily see my past health history, my current health status, and I would be able to understand all of the information that is present. On the other hand, I would be worried about the other people who would see his or her health information and feel scared or confused because they could not understand the information that was there. In the class of week 5, the two main topics were 1. How to find reliable resources online, and 2. The subject of eHealth. In this video, I will be reflecting on the readings that were assigned, and I will be explaining the artifacts that I chose to demonstrate my key learnings. For week 5's class, we were asked to read 4 pieces of literature. 1. Evaluating health information online. 2. Assessing the quality of internet health information. 3. Social participation in Health 2.0. And 4. Patients are destined to manage their care. In evaluating health information online, I found the key points to be A. Anyone can make a website. B. You should be suspicious if you cannot find out who is responsible for the information and if you cannot contact them. And C. The information you should trust the most is the information that is based on medical research. In assessing the quality of internet health information, a Health Summit working group developed criteria for evaluating internet health information. The criteria includes credibility, which includes the source where the information is derived from, how current the information is, and how relevant the information is; content, which must be accurate and complete; disclosure, meaning that it informs the user of the purpose of the site; links, that are evaluated according to selection, architecture, content, and back linkages; design, has accessible, logical organization and internal search capacity; interactivity, does the website include feedback mechanisms; and caveats, does the website clarify if the site is for marketing products or if it is an information content provider. Now, every time I go to a website, I can make a checklist to see if the website meets this criteria. In the journal article, Social Participation in Health 2.0, the authors start to discuss the idea of giving patient-centered care by using technology-mediated social participation as a new way to empower patients to become engaged in his or her plan of care. Technology in this article was seen as a tool. An example that the authors gave was a social networking site called Patients Like Me, where patients found strength and support from interacting with other patients who were experiencing the same or similar health issues. Even though this article touches on positives that relate to technology, it also mentions data smog, which simply means that the internet provides too much information or information that is too confusing for what people are researching. The key point that I took away from this article is that as healthcare professionals, we need to harness the power of the internet and use it to empower our patients. Finally, in the news article, Patients Are Destined to Manage Their Care, the authors argue that patients should be able to access their personal health information online. The authors make 4 arguments to back up their opinions. These arguments include: 1. The public wants information in the way they want it and when they want it. 2. Patients want access to their own patient information to know more about their illness, treatment options, and/or success rates. 3. Ultimately, it is the patient who makes the decisions on his or her health. And 4. Giving patients the ability to obtain information for themselves will alleviate the mounting pressures within the system. The authors ended by stating that by giving patients access to his or her personal health information, the patient's active decision-making will benefit not only the patients, but also the healthcare system at large. For my artifacts, I decided to focus more on the subject of access to personal health information and eHealth rather than on how to find reliable resources. Before I discuss my artifacts on personal health information, I decided to find the definition on what personal health information is specifically. The College of Nurses of Ontario defines personal health information as any identifying information about clients that is in verbal, written, or in electronic form, and it includes any information about the client's physical or mental health, care previously provided, a plan of service, donation of body parts or substances, a person's health number, or the name of the client's substitute decision maker. My first artifact is a YouTube video called Seamless Healthcare: Building a System Around Patients by Dr. Barry McLennan. This video explains how Sunnybrook Health Science Center has created an eHealth initiative. They made a service called MyChart. What surprised me about this video is that Dr. McLennan started off by discussing how healthcare professionals need to move towards a more patient-client approach, how they need to improve quality of care for everyone, how they need to improve access issues, and how they need to create better health outcomes. To me, this was very eye-opening because he was proposing that technology could help healthcare professionals do this by this new initiative called MyChart. MyChart is an online website that allows patients to access his or her personal health information. The patients of the center would go to the Sunnybrook Health Science Center website, and there they could log into MyChart. This video led me to explore this new idea more, so I went to the Sunnybrook Health Science Center website, and there they have it set up so that if patients have any questions regarding the MyChart service, his or her questions are answered. Here's the video that I watched.
Our system has evolved substantially since Mr. Douglas first conceived of a national Medicare program. But what hasn't changed is our commitment to care for those in need. As our system grew over the years, it has become more complex. In the process, unfortunately, we have drifted away from a patient-focused system, focusing more at times on the actual providers of care. Today, however, I'd like to suggest that we are making substantial progress in moving toward a more patient-centered model. But there is still much more to do to improve the connectivity and collaboration in our system. In Ontario, and actually throughout most of Canada, we truly are blessed with the building blocks of an excellent and potentially world-leading healthcare system. In this province, we have more than 150 hospitals, including large academic centers, community hospitals, specialty hospitals providing rehabilitation and complex continuing care, as well as many long-term care facilities. Our hospitals are the most efficient in the country. When we talk about the current reality, regrettably for many of our patients and many of our providers, our system is not much more than a collection of loosely connected parts. All is not dire, however, and as you can see here, we have some aspirational building blocks that are attempting to form a more cohesive structure. But they exist in an environment that struggles with connectivity and does not have the strength to bind it together into a functioning and well-built system, at least not yet. Our challenge then is how do we move from this to the future? Building blocks and metaphors aside, what we're really talking about is how we get these, in many cases, disparate, yet highly performing individual pieces of the system to actually come together to create something that will improve the patient experience with the entire system. Our challenge is to essentially build a healthcare system that will reduce costs, or better stated, deliver more value for money through improved efficiencies, improve the quality for all Ontarians, and particularly those in greatest need, improve access to ensure the system provides for patients equitably, and prevent illness and injury. Examples like these demonstrate that the healthcare system can achieve greater value with existing resources by improving coordination between all of the healthcare providers involved with a patient's recovery from an illness or injury. These initiatives will provide better outcomes for patients at a lower cost to the healthcare system. At Sunnybrook, we launched MyChart in 2006. Since then, it's become an incredibly popular tool for patients to keep up to date on their health information and share it with physicians and their family members. We currently have about 15,000 patients using MyChart. Essentially, it provides access to the patient's own electronic medical information. By logging on to a secure portion of the hospital's website, patients are able to view and share their own clinical notes and test results and receive educational materials about their specific health concern. We are now partnering with other providers in our local area, including the Central Community Care Access Center, and with their help creating a wider variety of healthcare-related information accessible to patients throughout the system. Imagine being anywhere in the world and able to access your own electronic medical record. By clicking on their health record, they're going to have access to clinical information ranging from clinical notes, laboratory results, EKG, echo reports, and now pathology reports for the patient's individual conditions. Any patient of Sunnybrook can have access through to their records and has the ability, if they wish, to import clinical information outside of Sunnybrook so they can have it with them, either as part of their record at home or when they travel. Another advance is e-discharge. When I spoke about Mrs. Harvey, I spoke about the current process in most hospitals, which is to print out a record, give it to the patient, let them take it with them. We now have the ability, especially with a secure connection in certain centers throughout the province, to create an electronic discharge record and push it out to the physician at the time. Basically, the clinicians build a discharge summary that can be electronically signed and distributed on the day of discharge. And I can tell you historically, it has taken weeks sometimes for a physician to receive a report on a discharged patient. So I'm going to speak very briefly about the Connecting GTA project, because this is very exciting for all providers within the Greater Toronto Area. This project spans the 5 local health integration networks. It's ultimately going to link health information across approximately 700 organizations with many thousands of providers within that area. In terms of population, that accounts for close to half the residents of Ontario. GTA, we are all looking forward to the day in the not too distant future where we'll begin to see the benefits of accessing information available from across the system. These are all helpful enablers to better connect providers and ultimately patients in our healthcare system. We have to do a better job of connecting primary care providers into our information management infrastructure. At a local level, we've started to make some progress with initiatives like MyChart and eDischarge, but we need to go much further down this road to ensure that there's a greater level of connectivity for patient care. This would improve access to specialists, diagnostic tests, and help create a greater sense of community between the hospital and its referring community. As our population ages and seniors develop multiple health issues, moving to this system is not really an option, it's an imperative. The sheer numbers of elderly patients will continue to increase over time and cause the system to stretch beyond its current limits as it exists today. If we value our system and see the potential of what it can be as providers, healthcare leaders, we all have an obligation to improve the delivery of care. As patients and taxpayers, we have an expectation that our system will evolve to meet the changing needs of our society. Whether we're leaders of organizations, direct providers of care, or patients or community members, we all have a role to play. Collectively, we must bring the building blocks closer together to build a system that we can be increasingly proud of and provide a legacy of cooperation and partnership that will improve care for all.
In relation to this video is my second artifact, which is a journal article on a study done at the Department of Veteran Affairs. In the study, the My Healthy Vet pilot program was a personal health information prototype that gave patients access to their personal health information through a secure portal. By doing this study, the results were that the patients found the program was very easy to use and to understand, the program helped the patients stick to their treatment plan, the program improved communication with their healthcare provider, and the program made it easy to locate relevant information. Most importantly, the patients stated that they felt their information was private and secure. In closing, I learned how to find reliable resources online by the readings that were assigned to do, and I learned the benefits of allowing patients to access his or her personal health information online. Even though I agree in giving patients access to their personal health information, I also understand the barriers in doing so as well. I do not think by just giving patients access to their personal health information, it will help them, but by giving them help in understanding the information, it will empower them to become involved in their healthcare. The Sunnybrook Health Science Center did an example of this. This center did not just give their patients access to their personal health information, they also provided an e-messaging service that allows patients to ask doctors questions about their personal health information. By doing this, healthcare professionals limit the barriers that are stopping the healthcare system from giving patients access to his or her personal health information.